Unfortunately, COVID is still spreading rapidly across the U.S. More than 330,000 confirmed and probable cases reported just yesterday.
The number of Americans hospitalized with COVID-19, more than 142,000, has surpassed last winter's peak, overwhelming hospitals and putting a strain on staff.
Dr. Siva Parcha is a hospitalist and practices internal medicine at USA Health. Thank you for being here, Doctor. There's been some debate over this one. How is the Omicron strain different from previous variants? And we're also talking symptoms here.
Yeah, thanks for having me. The Omicron virus the strain was first detected in South Africa last week of November. And then the WHO and CDC, listed it as variant of concern. And the way it's a little bit different from other strains is it does have a lot of mutations, on the spike protein. Now, the spike protein is kind of the anchor which attaches the virus to the cell, which makes it more, theoretically it makes more infectious, so it can spread fast. So that's how it's a little bit different in terms of, other strains of COVID-19.
Dr. Parcha, tell us what you're seeing. You are a hospitalist at USA Health. What are you seeing in terms of patients being hospitalized right now?
Yeah. So, I've been, ever since the COVID-19 wave started back in 2020, we've been taking care of patients directly in the hospital. And the thing which this strain or this wave is a little bit different, at least based on my experience, is a lot of patients are testing positive. They come to the hospital for whatever reason, and we test every patient who's being admitted to the hospital. And they test positive. They're testing positive, but most of them don't even have any symptoms, related to COVID. And even if they have like really milder symptoms, like runny nose, those kind of things, but definitely not as bad as how it was back in Delta wave or the original wave, what we had. So it's a little bit, again, it's too early to say. We still need more information, but at least the trends look encouraging. They tend to be milder symptoms, and like I said, most of them are testing positive, like just randomly. They don't even know that they had it. Yeah.
And we should also mention, just because you're vaccinated does not mean you won't get COVID, but those vaccines are meant to lessen the severity if you do get it. Talk about the effectiveness of vaccines against Omicron.
Yeah, good question. I mean, definitely there is so much of data out there now. So like I said in the beginning, this Omicron strain has a lot of mutations in the spike protein. Now, all the vaccines we have developed are targeting the spike protein, which is the anchor of the virus to the cells. So having said that, I mean, definitely it is not the vaccines what we have right now available, which is the Pfizer, Moderna, and Johnson & Johnson. They are not as effective, and you can still get breakthrough infections even though you're vaccinated, had booster. But the data is there out saying that these vaccines definitely prevent from serious illnesses, hospitalizations, and death. So those three for sure will help. And they are talking about tweaking the vaccines to include the Omicron. And I listened to Pfizer CEO just recently. He announced that they're going to come up with a vaccine targeting Omicron as early as March. So it's a little bit, definitely you can still get infected even though you took the vaccine, but definitely prevents from serious illnesses.
Dr. Siva Parcha, thank you so much for your time tonight.
Thank you for having me.